1 in 4 women will have their labor induced. Did you know that you must be at least 39 weeks to have an elective induction? And do you know the most common reasons for a medical induction?
Let's talk about labor induction. So, elective induction, when there's no medical reason, is actually not supported in the research and may cause harm. So, for example, what if a woman chooses to have her labor induced if her cervix is not ready for labor, or if not enough time is allowed for her labor to progress? That will increase her risk of C-section. Now, what if a mom talks to a provider and she chooses to go ahead to have her labor electively induced? If that is the choice, she definitely needs to wait till after 39 weeks. The reason for that is before 39 weeks, the baby's brain is still developing. And so what that means is that they would have a higher chance of needing to go to the neonatal intensive care unit because they could have problems with their breathing, with their sucking and swallowing, being able to eat, and problems keeping their temperature up. So there again, you want to wait to at least 39 weeks. Now, some organizations and some experts recommend waiting until the due date at 40 weeks or 41 weeks before induction for elective reasons. Now, we also know in the research that contractions from Pitocin, that's a synthetic version of oxytocin that causes contractions, it causes more pain with contractions than spontaneous labor. And women have told us that for years, but now we have research to back that up. Hi, I'm Susan White, certified nurse midwife with Childbirth Education for the Christian Family, and I want you to be informed so you can feel empowered in birth. Please stay till the end, and I have a free resource to give you. And also, please click like and subscribe if you're finding this helpful. Now, there are obviously quite a few medical reasons for induction. I have some of those listed here. So, for example, if mom develops preeclampsia, that is a reason for induction. And that's when mom would get like high blood pressure, maybe protein in the urine, swelling that doesn't go away with rest, headaches that don't go away with Tylenol. Those could all be symptoms. If the mom does have preeclampsia, though, that is definitely a reason for labor induction. If she had high blood pressure even before the pregnancy, there's recommendations for induction for chronic hypertension. There again, if she had diabetes before the pregnancy, that would be a reason. Or if she develops gestational diabetes during the pregnancy, there's also recommendations for induction. If the baby is not growing well, that's called fetal growth restriction, that would be an indication for induction too. Now, what if everything is totally normal? Mom and baby are healthy, but she goes past the due date. Well, in that case, once she gets to 41 and a half weeks, so that's 1.5 weeks past the due date, that would also be a reason for induction. And that's because after that point, the placenta doesn't work quite as well, and that means there is a higher risk of complications for the mom and the baby. Would you like to have a free copy of my resource should you have your labor induced, and also save a discount on my Childbirth Education classes? Just go to the link in the description.